picture is worth 1,000 words, and we're going to try to get this in the advance. They didn't come, but with almost 300 of these vigils across the country, there will be photos somewhere. And
20 vigils in New York State alone.
Yes, yes. And in all of the boroughs.
Every borough and all around the state.
So, Staten Island is not left behind. Staten Island had a vigil day!
I wanted to have a life as well as being disabled. Yes, I had children after I was disabled. I did all kinds of things normal people would do. And yes, it means I cost a little more money than the average person probably. But I think I deserve health care.
I mean, this is the time, guys. This is the time. I will say yes, health care for America now. I mean, you cannot be a developed country with 40 million people without health care. You call yourself a developed country and you have 40 million people on hand which don't have the health care, a basic need. I think this is the time the Washington should act. I mean, majority of my patients belong to McMahon's district. Seeing him voting no for healthcare really hurt. I think he doesn't know what exactly the situation is. Guys and friends, I mean, I'm very happy to see you all here in support of the healthcare. I will say healthcare for America now. I mean, if justice is delayed, justice is denied. Similarly, healthcare delayed. If the reform is delayed, you are denying the healthcare to millions of, hard-earning families. You are pushing them to bankruptcies. This is not done. Raise your voice. Ask Washington to act now. Healthcare for America now, now, now. Thank you.
Thank you.
Right.
Thank you.
Come on, what's your name?
Maureen Donahue.
Maureen Donahue. Go ahead, come on. Say a few
Okay, I'll say quick. I'm definitely bankrupt for medical. But I came here because of my cousin, who had no health care, went to an ER because they lost a job and died, struggling to breathe 3 days later after a doctor dismissed her. And for my brother, who had Medicaid. I have a public option. I have Medicare, which has its faults, and so does Medicaid. But we need a competition for the profiteers. When I had my 3 children originally, we paid them off. It cost me altogether in the 60s $400 to have a baby. It now costs $25,000 to have a child. That is part of it. Until we start working on the profiteers, and the public option is the first step. I know the public option is going to hurt me, but my Medicare, I finally hit 65, and I can't afford my supplemental, but it's a start, and we need it.
Absolutely.
Right.
Thank you.
You're welcome.
Thank you.
And this is David Greenson. He is a volunteer at MoveOn, and he's the person who got me involved. David and Kathleen Kelly over hiding in the back there.
So, folks, I just wanted to urge folks, if you take one of these flyers with you that has the phone numbers for our senators, certainly we want to keep our eye on Congressman McMahon, and we want to keep pressuring him that when the bill comes back to the House that he's going to vote yes on it. But actually right now, one of the most important people in this country is Charles Schumer. He is literally in the room right now as we speak, negotiating around whether we're going to get a public option or not. There's a gang of 10 senators. This is what's happening right now. So we need to be calling them every day, letting him know that we thank him for, he's been one of the biggest champions so far, but we need them to know not to let up. And also you can call President Obama. We also need President Obama not to start backing off from real healthcare reform right now. We've come so far, and it's really close to getting just an historic achievement. So I urge you all to make these phone calls and make sure that we don't let up now. You could redirect me.
David, I have a question. What do you say to people who would rather have nothing for all than Medicare for all? In other words, single payer or nothing. How would you respond to that?
I think that, I certainly, I'm sympathetic to wanting, we really want all Americans to be covered. I mean, the fact that we have 2,500 people going bankrupt every day is just a national embarrassment. I mean, you know how many people go bankrupt every day in Belgium or in France or in Germany? I mean, it's zero. So, I mean, it's just appalling that we're in this situation. So to me, at this point, I think we have to push forward. I mean, people look back to previous struggles, like the struggle for civil rights, and we look at the 1965 Voting Rights Act and the 1964 Civil Rights Act. But people don't remember there was a 1957 Civil Rights Act. I mean, there were many steps along that progression. You don't necessarily get everything you want the first time out, and I think it's a mistake to not try to get everything you possibly can, and then keep pushing. It's not the end of the story. I think, as Maureen said, it's a first step, and we'll keep moving after that.
I've taught with CUNY system. I've taught for several years, but even now, as an adjunct, I still don't have health insurance, and I realize that I'm not just speaking for myself. I'm speaking for thousands of other people, not just in the CUNY system here, all over, who don't have health insurance.